We are live. Good evening, Dental Hacks Nation. It's me, your old friend Jay Lips. And tonight we have another very special after school special buffering. Why other kids are doing it and why you should too. Um, but tonight we have with us a recurring guest and a recurring person within the Dental Hacks Nation, Dr. Aaron Elliott. Dr. Elliott,
Hi,
how are you?
everybody. I'm excellent. I just got done with a day and trying to make myself presentable. I just had two new patients, new transplants from California. It seems to be what we're filled with nowadays. And I just told him I had to go run off to get on this. So now the pressure's on to give comfortable injections when they come in.
Mm. Aren't you like pushing them away to tell them to go back to California that you don't need anymore?
No, I can't be a hypocrite considering that I grew up south of Boise as well. That's what
Oh,
I tell my
do people
patients
know that?
anyways. It's not lying. Yeah, well, when they're from California, I can share that. But I left in 1995. That's
Truth
going
comes
to
out.
that's
Yeah,
going to tell you how old I am because that's when I graduated high school. So it's been a minute.
the OG years.
Yeah.
Well, also with us tonight is Brad Winter, who is from Anutra Medical. So he is going to be joining us a little bit and kind of popping in um, and uh, and helping out and filling in the spots that Aaron and I don't know. So hopefully he'll have some good information for you too.
Yeah. Hey, thanks for having me, guys. Drove in from Columbus, Ohio today, so had a nice little drive through the mountains down here, and I'm excited to get on here and talk a little buffering with you guys.
Nice. Everybody's buffering these days, is what they do. Um, well, a lot of people out there are probably saying, what is this, and why should I have it in my practice? So, who wants to kind of get the ball rolling a little bit and tell us what exactly this is? A lot of people probably heard of buffering, um, but may not be really familiar with the whole process.
You
So,
know, Jason, I will start with that because I think a
nice.
lot of a lot of dentists um tend to be what if people. Like we think of all the reasons why something won't work. And I also think we're plagued with it just fine. And what I mean by that is I I actually am kind of proud of how comfortable I can give injections. So why would I change anything? I can get blocks, but there's always those patients that ruin your day and they can never get numb. We blame them for having redhead in their family somewhere along the line, or they had a hot tooth.
Gingers.
um, so I feel like I had all of the same things. Like, why would I change anything when what we're doing is working just fine? And it's kind of like, well, why sending my crowns to a lab works just fine. But as we evolve and improve, I knew I wanted to bring this in. One, my friends were talking about it, but two, we had Stanley Malmed here for a full day lecture last March. I wasn't able to attend, but I got the notes. And yes, I'm that kind of nerd, and I went through it. And he just showed too much proof to not use buffering. And I just wanted something easy. I'm all about like simplifying, and anything I can delegate is always great as well. And when Rich Rosenblatt talked to me about Anutra, I'm like, sure, I'll give it a try. And that's when I got to meet Brad. But it was like almost immediate. I could notice a difference in many things, which we can talk about. But um, even when I give good, injections and patients are like, wow, I hardly felt that. You always think about this hardly, right? Hardly felt that. And there was always like a nose scrunch, which if Ollie's watching, that's what I'm famous for. Um, but it,
Brad Keener.
yeah, but it really took away that stinging. And the patients, when I asked them, they said that afterwards they didn't have discomfort. And most importantly, we get pulpal anesthesia fast. And I can go, I have some nerdy stuff I would love to talk about, but I just wanted to give a quick intro as to why I finally changed. And that I had all the same, I think excuses are a good term, as to why I didn't need it. And now that I have it, I can certainly see a difference. And it's like the easiest thing in the world to implement. It's not like implementing sleep.
Right. Yeah, I think you brought up a good point, Dr. Elliott. We all get stuck in our ways. You know, we're used to doing the same thing that we've been taught. Don't necessarily always like change. But one thing buffering is proven to do is to give tremendous patient comfort, like you talked about, but also the onset. And I think, you know, in today's world of running a great business, but also kind of in these COVID times with, you know, getting the patient in and out, you know, having a syringe that can be sterilized, there's all these different factors that are playing in. I think buffering has become more of an acceptable, okay, I'm going to look at this, I'm going to try it. Oh, wow, it's really working. Whereas it's been all my life. That's kind of what we're seeing right now with our customers.
Why does it work so well? What's the mechanism in there that makes it all happen?
Yeah, so good question. So it's simple. It's sodium bicarb. And the traditional anesthetic that you guys, you know, have always used, it has a preservative in there that keeps it stable. And when you inject, your body has to break that down. So it takes a little bit longer. But when you add sodium bicarb to lidocaine, it has a neutral pH and then speeds up that onset. So it's already buffered by the time, you know, you do that injection. So your body absorbs it rapidly. So something as simple as baking soda changes the world.
Can I get a little nerdy here? In regular anesthetics, like lidocaine with epinephrine, the pH is like 3.6, and lemon juice is 3.3. And there's this factor called RN, and when it in order to be lipid soluble, to get into the nerve, you have to get close to the nerve, and you have to have it uptake into the nerve. And so that's why infected teeth are way harder to get numb, because it's already acidic there. And so this RN has to become positive inside the nerve. But in non-buffered anesthetic, there's only 0.0004% of that RN. So yeah, but when you do buffered, it actually
show all the notes written on your arm right there. I just want to see that.
It's 6,000 fold more of that RN lipid soluble to get into the nerve. So the biggest thing for me when I went through Malmed's notes is that we can have lip sign 85% of the time after 8 minutes, but only 40% pulpal anesthesia. And to get to 95% pulpal anesthesia, it takes 45 minutes. And to get to 70% pulpal anesthesia with lip sign in buffered, it's 2 minutes. But to get to 95%, it's 8 minutes. And that to me is a huge difference. Like whenever I have to block someone, especially for just like one tooth, I have this little bit of like, is it gonna work? And now it's like I get drilling on a tooth and I don't have that kind of waiting for the jump, you know, like, did I get him numb this time? Because
Right.
this is what we do, right? Hey, are you numb? Does that feel different than that? Get the rubber dam on, let's go. So I feel like it took away some of that apprehension. And I will tell you, because I've heard feedback from some friends that tried it, and they feel like they used to get more blocks. But if I have to go back in with a Lido, what I know, yes, we'll get the lip sign, but what I know is once I get that, they're numb and they're ready to go. Like you don't even have to leave the room to go jump on Facebook and change someone's mind. You know, it's what I do with
I'm not
patients
going
are
to use it.
getting numb. Or I'll go run and do an exam, but like, hey, we need to let you marinate was always my excuse. But at this point, like after a minute or two on the maxillary, I can get started. So it's kind of runs more efficiently, but we don't have those appointments where it's like, oh, we can't get this patient numb and the next patient's here. And it has alleviated a lot of that.
But my little white lies are the things that keeps me going through the day. I have to have excuses. So in my office, for instance, I have let's see, I have a Prilocaine 4% without epi, and then I have a Septicaine 4%, and then I have a Xylocaine 2%. Does this solution kind of help replace all of those? Is it kind of a panacea when it comes to that, or how would you explain that if somebody was saying, "Hey, does this really do these different things that I need it to do?"
Do you want to take that, Brad? I was looking at Brad Keener's
Oh, I
comments.
thought you were I thought you were gonna take it.
Don't get catered.
You can take it. That's fine.
No, ask the question then.
Keener messes up everything.
I know.
No, I in my office I use a 4% Lidocaine for
Yeah.
blocks before using a Anutra, and then I would use either a Septicane 4% 1 to 100 for infiltrations, or a Xylocaine
So
2%
I
1
do
to
have an
100.
answer for that. So a lot of people use the plain first because it's less stingy, but its pH is 5.9, whereas buffered is like 7.7, and the body has to convert that to a neutral pH in order for it to uptake and block the sodium channel blocker. So if so the plain, even though it's less stingy and you get profound anesthesia, it's not that much different than buffered. So I think buffered sting and less trauma to the tissue afterwards because it's not acidic.
I think your microphone switched around a little bit. Aaron's audio is a little. There we go. I think your earphones are disconnected. I still can't hear you there.
No?
Can you hear us? There we go. That's better.
Okay.
So Aaron broke it. But no, I guess a lot of people are probably wondering about the system. Somebody asked on there, can you use it on Septicane? So obviously this is a standalone system, not something that you use in addition to the other cartwheels like we have in the past.
Correct. Yeah. So right now, we use a vial of lidocaine, and it's like Septicane isn't made in a vial currently. So we always kind of say, hey, this is your 98% rule. You're going to use this 98% of the time. A lot of our customers, keep something else on hand, uh, for certain situations, but currently only lidocaine is made in a vial.
And I actually have the unit right here. So this is actually what it looks like. This sets on your desk there, and I'm going to take the back off. This is what's inside. This is one that I've used, or used up rather. And there's a little cartridge in here. I'm going to have to release it a little bit. I didn't prepare very well for this. Let me see if I can pull this out there.
Let's see if Elliot did a good job training you.
So this, I messed it up on my first go round. So if you do buy this, make sure you read the directions, because you will spill lidocaine out everywhere. And we lost Aaron for a second there. I don't know any pHs, so Aaron will have to come back on for that. I'm sorry. But this is the lidocaine vial, and this is the bicarbonate. So this clicks down into this little cartridge, and that actually slides into this dispenser that sits on your desk there. And it sits just like that. There's a little knob at the top there. I'm sorry. And Aaron's back. Don't break it again, Aaron. I was on a roll. But it comes these prepackaged syringes here. So are these aspirating, Brad? Are they?
Yep, they are. Yep, those are. That's a 6 ml aspirating syringe.
I haven't got a positive aspiration yet.
keep trying, Aaron. You were thinking about your pHs too much.
I know. Like, how much did you hear? Did I explain why plain is better, but it's not as good?
You did.
You
yes.
did wonderfully. Okay. So basically, every day you come in, and this little syringe screws onto this guy right there. Maybe. My camera is not very big there. and then up top there's a little dial there. So you click one, and you pull 1 milliliter rather.
Milliliter.
Um, and then for every milliliter that you pull, you click it,
Yep.
and you fill it up. Um, and usually the regular carpio is 1.8 or 1.9
Yeah.
milliliters. So what's the average dose? So if you were doing, so the average dose for an infiltration or the average dose for a block, what would you pull on there?
Honestly, we don't recommend what to use. We just say follow your standard protocol of what you're currently doing. There are a lot of times that our customers will come back and they'll say, "Hey, I've been able to figure out I can use less anesthetic on some things because of how profound it is." So again, we're not giving dosing recommendations. We just let you guys follow your normal protocol. And so Dr. Elliott might have an example where that's been.
Well, no, I was just going to say, if you, like, a lot of people do a plain and then a Lido, they have to go in twice, and now
Yep.
you can just load basically 2 carps worth if you want.
Well, even if you're doing a larger case, that syringe holds up to 3 carpules. So you technically would not have to leave the mouth when giving injections, which is going to be more efficient for you, not having to change carpules out, but also better for the patient. They're only seeing that needle come in their mouth once.
Yeah, and it's been great. I usually have my assistant pull just a little bit extra and just have it sitting there. And it's pretty easy. And then if you just want to switch the tip, you've got the different short and long needles in there too, which are easy to change out.
Yeah.
So when I've talked about this online, I usually get 2 other objections. Is one is that I can just do it myself, and I kind of like a system. I'm not a big do-it-yourself, and I know there's some competition, but
Brad
it's
Keeney's
kind
a
of
big do-it-yourself type of guy.
Yeah. I'm glad you said it. But saying that it's like an unlimited amount, so to me, it's like just a system, a flow that I don't have to worry about. It's easy to order more. And so when it comes to cost, I'm not the type that counts cotton rolls. And if the patient can get numb faster and more profoundly, and I can do more in less time, kind of doesn't matter what it costs.
Yeah, and I've tried it probably 5 or 6 years ago, doing it, trying to mix it on my own, and I never felt like I get it right.
Yeah.
And then it would sit there too long, and then I kind of thought it was probably expired, so I just I'm not gonna try it again. But this is so much easier, and it's easier for my assistants to go ahead and do it and get it loaded. And they don't have to ask what type of anesthesia we're going to use. It's just like, boom, there it is. And they'll just have the different needles out and just ready to roll. But somebody also said on there, buffering isn't real. Change my mind. Controversy.
I don't want to get into the science again, Brad. You're from Arkansas.
They don't numb in Arkansas.
Hey, here we can prove it. We'll just for we're doing a little special here. You can try out for $2.99 and see if it's real or not.
Or I can come down there and show you.
That's right.
She'll do it too. I've seen it. So tell us a little bit about the package and what they get if they were to order this. And
yep. So for having us on here, obviously thank you for doing this. For anybody that's joined live here for this session of buffering, we're offering a device and a month's worth of product for $2.99, which is a great deal. That gives you just enough product to try it and really see the benefits and understand how it's going to flow in your office. And then the one cool thing that we've started implementing, and maybe Dr. Elliott could talk about this, is we have a licensing program. She kind of mentioned it earlier, where you can sign up for our license agreement with us, and we have an online portal. You can go in and you can order as much or as little supplies as you need. There's just a fixed monthly cost, so you don't have to worry about overstock of inventory, your cost fluctuating. So we've we started implementing this program, and it's been a tremendous, I guess, response from our community. And it's something that folks that wanted to buffer before always thought it was too expensive. This is kind of going to eliminate some of that cost and save them some money and time.
There was a question for how many doses in the month supply?
Yep. So we send out in your first trial box, we're going to send out 200 mLs of lidocaine. You're going to get 4 sticks of the sodium bicarb, 50 syringes, and a couple hundred needles. 100 of the 30 gauge and 100 of the 27. So we find that for most offices, that gets you 3-4 weeks. If you're just seeing a steady flow of patients doing 10 to 20 injections a week.
I don't think Zach sees that many patients, so you would be fine.
Just give each one a lot more.
Yeah. Here's another cool thing too is I know Dr. Lipscomb, you kind of said about things expiring. With our device, it's a closed sealed system. So once you pop that lidocaine open and start to use it, you have up to 14 days to use it. So in the past, low volume offices kind of shied away from this because they were always worried about, I'm not doing enough injections and I'm just going to throw it away. So we were able to get the shelf life expanded to 14 days. So that's going to allow for lower volume offices to be able to grab the benefits of buffering.
Brad, I have a quick question for you too. Something that we think about in Idaho, and I'm sure Ohio and maybe Virginia, is that we get a big supply before the big freeze.
Yep.
Is that a concern with this as well?
So, obviously you don't want anesthetics sitting in a cold truck somewhere being transported. So our customers that do have those situations, you can order as much anesthetic as you want before the freeze. What's the great thing about the portal. You can get online and you can stock up for the winter months, and so you don't have to worry about things freezing in transit.
Nice. And if you think about it too, if you're doing if you're doing infiltration, a lot of times you're throwing away a half a carpule here and there as well. So I mean,
that's
a lot of that stuff is you're wasting it. And too, with the medical waste thing, Stericycle has kind of fussed at me a couple of times for throwing away those little carpules or putting that in the system. So it's a good way. I bet there's going to be regulations coming down the line that are going to be a little more strict on that. So this type of bespoke system it's probably going to be a little bit more ready for that when it comes down.
Well, and to think about just everything that's going on with keeping offices clean, COVID times. With a syringe, you can it's a single use. You don't have to worry about going to sterilize it. And did my sterilization machine run the cycle complete? Is it up and running right now? Taking time, cost to do that. Once you're done with our syringe, you can just dispose of it.
Just set it and forget it. Well, thank you guys. Thank you for coming on. I know I've enjoyed using this system, and I heard about it from Rich Rosenblatt and Mina Barsoom of CDocs, and kind of started the conversation. And it seems like it's spreading around. I've heard a lot of different people starting to use the system, so it seems like it's really catching on. So it looks like you guys have a good product here.
So how do they get a hold of you?
Yeah, you guys, if you have any questions or would like to give this a shot, you can email me at brad.winter@anutramedical.com, or you can call me or shoot me a text if that's easier at 614-935-0545. Did you like my pun there, Dr. Elliot?
Yeah.
Thanks
puns.
for spelling it out. Thanks for spelling out so slowly so the doctors in Arkansas could understand.
I'm real smooth.
But once again, Anutra Medical, go get yourself one, and everybody start buffering out there and have some happy patients. So thank you guys, and thanks Dental Hacks Nation. Good to see you all. You too, Brad.
Yep.
Brad Keener, that is. I'm looking at Brad Winter right there. He's right across the way here. I'm in my little glass cage over here, but thank you guys, and I hope you have a good night, and we will see you next time.
Thank you.